So for our post-op tummy tuck patients, there's a lot of questions that are often asked, and I'm going to just touch on the highlights of them. And you always can call our office and ask questions if you do have them, but really important that you follow the instructions that we give you to optimize your results. And so the first thing is that almost always we use a drain after the surgery. And the reason for that drain is to help prevent fluid collecting underneath the skin. And we're gonna send you a little video on how to manage that drain, but it's very, very important that you feel comfortable or have someone there with you in the first 24 to 48 hours after the surgery, after a tummy tuck, and that you don't try to do this on your own. So number one, please have someone with you that can help you with getting up, out of bed, and then also managing the little drain that you have. A lot of people get concerned about the drain and they think that the drain's gonna hurt afterwards. I promise it doesn't hurt at all. Sometimes you don't even feel it when we remove it. We normally remove that drain around 7 to 10 days after the surgery. Sometimes it stays in a little bit longer, and the reason we have it staying a little bit longer is maybe you've had a little bit more liposuction or you've had a large amount of skin that's been removed. And in those situations, there's gonna be more chances of fluid accumulating underneath the skin, and we don't want that happening. That's called a seroma, and that's gonna delay your healing process. The next thing is making sure that you're really eating enough nutrition, both by drinking and eating enough nutrition. So we wanna make sure that you're staying well hydrated and eating a lot of protein. And we've talked to you about that as we have already preoperatively, but I also want to bring it up postoperatively that you eat 100 grams of protein a day and also be taking some collagen peptides, which will also help with your incision. Now remember, we never want you to be smoking in and around the time of surgery. So please do not smoke a month before the surgery and 4 to 6 weeks after the surgery. So it's very, very important. It can cause the incision not to heal well. And so that's another thing to emphasize to you. And thankfully, our patients are really compliant and don't do that. But if you were to do that, it could be very detrimental. The next thing is getting up and walking. You know, the time after surgery is a time to really be moving and getting up and walking. And that helps do a lot of things. It helps decrease the swelling, helps prevent blood clots from forming, helps you recover quickly. So we really want you getting up and walking very quickly. So the next day after surgery, I want you up and walking around the house. Within a few days after surgery, I'm generally, after a tummy tuck, wanting you to be walking outside. A week after surgery, you could be even walking a mile outside. 2 weeks after surgery, walking 2 miles. So walking's critical. The next thing is wearing a compression device. Very, very important. Compression will help decrease the swelling, help with your contours, and it's just vital to wear. We'll give you generally that first stage compression garments that you wear while we have the drains in place, and then you'll need to go get a second stage garment or a tighter garment at some locations that we do provide for you. We also, if we did liposuction, might talk to you about wearing some foam padding and some boards to wear, and that just also helps with the contour. But it's just very, very important if you can just follow our instructions post-operatively. A few other things is really important is that when you do take off that compression garment and you're at home, we get a lot of calls because people will take it off and then they'll feel lightheaded. What the compression garment is doing is it's keeping your blood vessels nice and compressed, and then when you take it off, your blood vessels dilate and your blood pressure lowers and you get dizzy. So it's super normal to have a lightheadedness when the compression garment's taken off. So please, when you do take off the compression garment, the first few times, have someone with you while you're taking it off. When you go to shower that first time, sit in a plastic chair or a stool in the shower, or have someone there with you in the shower while you're showering, because that's another time that you can feel dizzy. But I promise, the discomfort that you feel in the first few days and kind of the bloating and everything else will quickly go away. And within a few weeks, you're gonna be feeling so much better. And then in a few months, once all the swelling's gone away, you're gonna feel fantastic.